Hello, everyone. I'm Shelley Stedke, and I'd like to welcome you to the online webinar, Revisiting Dental Hygiene Ergonomics. Equipment and self-care make a difference. A little background about myself. I've been a dental hygienist for 28 years and have spent my career in clinical practice and dental hygiene education. I've been interested in the physicality of our profession since I began to experience pain in clinical work around the year 2002. After I began to teach several years later, I worked with some physical therapists on an interprofessional research study regarding the onset and frequency of physical pain in dental professionals. It's fairly well known that we have a physically demanding job. What I didn't realize is how prevalent musculoskeletal disorders are in our profession, how early they can have an onset, and how many people actually leave dentistry or retire early due to ongoing MSDs. We were taught early on that proper ergonomics would combat the onset of pain and help us stay healthy in our workplace. But what it took me years to realize is that there are many things to consider in addition to the best ergonomic practices that can impact our comfort level, our health, and the longevity of our career. Throughout the presentation, I'll refer to hygienists regularly because that's kind of how I created the presentation. But please know that if you're a dentist, an assistant, or any other dental professional that's here, many of these things also pertain to you, and I'm so glad that you're here to join us this evening. Just to let you know, this is a sponsored CE from NSK Dental, and I have received an honorarium to present this educational information to you all. So here I've listed some learning objectives for this evening. We're going to talk about each of these a little more in depth as we go through the presentation. By the end of this evening, I hope to have given you some tools in your toolbox that will make you more aware and discerning of your work environment and the interactions there. A review of some basic ergonomic principles that I'm sure you've heard before, but sometimes it's nice just to bring these things to the forefront of our minds. And some alternative methods of care that may be worth finding out more about for you or for someone that you know that may need treatment for pain. Some of these methods can also be used to prevent or delay the onset of pain and increase the sense of well-being. They're not exclusive in their use to target MSDs. In other words, you don't have to have an injury to go get a massage, but we'll discuss the benefits of these treatments alone or combined for treating musculoskeletal disorders or MSDs. I'll try to refer to them as MSDs throughout, but especially those brought on in the workplace. We're going to begin with some definitions here. So ergonomics, what is it? It's the science of the workplace tools and equipment designed to reduce worker discomfort, strain and fatigue, and to prevent work-related injuries. Human factors, the study of the interrelationship between humans, the tools and equipment that they use in the workplace, and the environment in which they work. These definitions are common in many industries, not just in dentistry, and they're very similar. I like to think of ergonomics as the optimal interaction with our surroundings and the human factors as a study of that interaction. But what's important to know that no matter how you think of them or how they're defined, is that many people are researching these concepts because injuries or MSDs are common across the board. The US Bureau of Statistics noted that in 2018, in the private sector, more than 900,000 days of work were lost due to an MSD. Four of the hardest hit industries were retail and trade, manufacturing, social assistance, and healthcare, which combined, these four industries combined, reported 50% of all MSD cases in the private sector. Healthcare was the #1 industry that is affected by MSDs. On a happy note, the incidence rate of work lost to MSDs has slowly been declining since 2013. But this is important in our industry because we interact with a lot of equipment most of the day, each and every day, and this interaction, if negative, can have long-term health consequences. It's also important to realize that this is only one piece of the puzzle and a multifactorial approach to staying healthy. So the CDC defines an MSD, as an injury that the work environment and performance of that work contributes to that condition or injury, or as a condition made worse or that persists due to a work environment. They're common in careers that have repetitive motion, static postures, and adhere to awkward positions frequently. I'd say this pretty much describes most dental professionals' career in a nutshell. I bet that when you decided to become a dental hygienist or go into another area of dentistry, MSDs weren't at top considerations on your list. Not many are going to sign up for a career that makes you sit in awkward positions, learn how to multitask with several pieces of equipment for every patient, work in a moist, dark, small field, and then clean up and do it again several times a day. But that's exactly what we do. And that's who we are because we care about our patients, their health, and their well-being. But now it's time to put yourself into this equation and figure out the best way for you to continue doing the job that you love while taking care of yourself. We know that ergonomics is stressed in school, but what about after that? Who's checking in on you to make sure that you're getting the care that you need? Research has shown that between 69 and 96% of dental professionals have MSD symptoms, sometimes beginning early in their clinical education. We know that technology and equipment continue to advance in ergonomic design and user friendliness, and that there are companies that research manufacturing and design. They put in time, effort, and money into creating modern ergonomic friendly equipment for use by people in our profession. However, the problem of MSDs still persists. So we are experts at determining risk factors for our patients. For oral disease, we assess every patient individually. But what about risk factors for our own healthy job performance? Sometimes these are unknown or they're overlooked. So these are some more common risk factors for dental hygienists. Repetitive movements. When we do the same thing over and over every day, which we do every day we're practicing anyway. Sitting in awkward positions for long periods of time. One study found that dental hygienists spend about 50% of their working time with at least 30 degrees of trunk flexion and 86% of their time with at least 30 degrees of neck flexion. I'd say from this picture, he's a little more engaged than that, but that's certainly not a position you want to hold for any period of time. But once we're in these unnatural positions, we begin to use compensatory muscles to keep us in those unnatural positions. And this can lead to long-term muscular imbalance, which also long-term affects joints, tendons, and nerves. The lighting that we use affects our job. Many of us now have loops with lights on them, and if you have those, that's fantastic. But please don't forget about your overhead operatory light. Both should be used for optimal field of vision. And if you've gotten away from your operatory light, reintroduce yourself to it and notice the difference in how much better you can see in the patient's mouth. If you don't have loops, I encourage you to consider getting them. Stress. We'll talk a little about stress. Life always has some stress, we know that, and stress isn't always a bad thing. It sometimes motivates us to do some pretty good things. But let's face it, most of 2020 and the beginning of 2021 have really been incredibly challenging times, especially in healthcare professions due to COVID and all of the trickle-down effects it's had on all of our lives in so many different ways. How each of us deals with this stress is different, but many times the body is connected to that stress and it lets us know that something is not right and it needs to be dealt with. And if it's not dealt with, it will continue to accumulate. Genetics. We're all made a little differently and are affected differently, short and long term, by internal and external stressors. What bothers one person may be fine for another. But the goal is to know yourself, to be good to yourself, and to take care of yourself with what you have been given. So here's some information that might be alarming. We talked about the high prevalence of MSDs in dentistry. That's probably alarming, it should be. There's a lot of research that supports this, and they have shows very slightly varying numbers depending on what research study you're looking at. But the point is that they all agree MSDs, or injuries in our profession, are a problem. Specific to hygienists compared to other dental professionals, generally we have more pain. The areas most affected are the neck, the shoulder, the hand, and the wrist, followed by the lower back and hips. Symptoms begin early on many times, but it's also important to point out that typically, the longer you've been working in years, the number of hours you work per week, and as well as your patient load, seen over a period of time, is positively correlated with the rates of injury or MSDs. So in other words, the longer you work, the more patients you see, and the more hours that you work, the more risk you are at for an MSD. Most research regarding MSDs is for all groups of dental practitioners. There is some specific to hygienists, but more research needs to be done regarding long-term treatment of MSDs among each specific type of dental practitioner. So what are some signs you should be looking for to know if you may be developing an MSD? Pain, obviously, some tingling, numbness, possibly inflammation, and maybe decreased strength. Sometimes decreased strength is the most subtle onset sign, and it can begin early. If you notice problems opening jars, moving things or lifting things that were not hard to lift previously, but they are now, this could be the sign of an onset of an MSD. So some of these are fairly obvious, some of them are not as obvious, but if you do begin noticing these items, don't ignore them. Think about things that you may change or do yourself to help combat these symptoms. Things like strength training, maybe sitting in a different position when you're seeing your patient, changing your instrument grip slightly, changing the location and accessibility of your equipment. These are just a few that you can try for relief, and if it doesn't come or symptoms worsen, it may be time to seek some professional treatment. So what is the exact cause of these pesky MSDs? We talked about the risk factors and the warning signs, but the root cause of MSDs isn't fully understood. We do know they progress in stages. They can become chronic. There is a lack of blood flow that could have something to do with it to certain areas. And also the overuse of muscles or compensation by other muscles can throw our bodies out of balance and lead to injury. All of the following are factors that should be considered when facing an MSD. They should also be considered for prevention of MSDs if you don't have one. But equipment and environmental factors, revisiting correct positioning and self-assessment, changing habits when necessary. There's some traditional treatment options that should be considered. We'll talk about complementary alternative medical treatments, and also the addition of targeted self-care modalities. First of all, let's talk about our equipment. Then we're going to go on to talk about some PPE, some self-awareness of our body position. We're going to review some patient and operator positioning, go back to the very basics of probably the first few months of dental hygiene school. And then we're going to talk about our operatory and the surrounding areas. First, let's talk large equipment. I wanted to show you all a picture of some seriously older dental equipment. This is just to remind you of how far we have come in our profession over the last 50, 60 years. This light's huge and it's very heavy. The chair reclines. I'm not sure if it's power or manual. It looks like there's a headrest and maybe a belt drive for the handpiece. I'm not sure. Either way, it looks a little bit intimidating, and it's certainly not something any of us would work with today. But it does show you that even then, manufacturers were creating equipment that was somewhat catered to our needs as much as they could. The second picture down in the lower left shows a little bit more of a modern setup. It's definitely not state of the art, and it's not ideal for maintaining long-term physical health. This may be something that you're working with or maybe have worked with in the past. It depends on how long you've been doing hygiene, but we'll talk about why it's not ideal a little bit later on. Moving on to small equipment. So in addition to the large equipment, how we interact and utilize our small equipment is very important. Let's talk about some examples of small equipment that we use daily. And these are just ones that came to the forefront of my mind as I was creating this presentation. Loops, hopefully you're using these daily, and they are very helpful. There is some research that has been done that shows when loops are used properly, they do help maintain a neutral spine and may help decrease the onset of some injuries or MSDs. However, if they're not used properly or if they don't fit properly, there's really no benefit. It could actually be harmful. Moving on to our gloves. So proper fitting of our gloves decreases hand fatigue and it gives us a full range of motion. They should fit snugly on the hand without being so tight that they're stretched when we move our fingers. If the gloves are too big, this can also lead to awkward hand movements and over time compensatory muscle movements. If gloves are too tight, it can lead to skin irritation, limited fine motor skills, and hand fatigue. So I encourage you to find some good fitting gloves. I know everyone's hands are different, and I know that this can be an issue at certain times, but it's worth the hunt for a good pair of gloves. Saliva ejectors or your high-speed evacuation. The reason I put this in there is because I want you to think about where it's located on your delivery system. How long is your suction hose? The main reason I'm mentioning this is because I've worked in many offices where you have to reach quite a ways to get the suction, and if the hose portion is not quite long enough, we're consistently putting a slight strain on our arms to hold it there. Long term, this can lead to injury. Knowing that suction hoses come in many lengths, they're inexpensive to be replaced, and they can be replaced easily by a dental technician. Just reassess what you've got. Ideally, they should rest easily on around the patient's mouth and not give any tug back to your arm or hand, but also be short enough that you're not rolling over them with your chair. So computer keyboards, where is this in your operatory and how do you use it? Some offices are retrofitted to hold these nicely. Others don't have any type of tray for the keyboard in the delivery system. If you have to twist or turn your head or trunk repeatedly daily, this could lead to long-term fatigue and possibly injury. Your hand instruments. It's pretty common knowledge that larger handled and light in weight hand instruments, mostly with texture, help to reduce hand fatigue long-term. It's also important to consider your grip, the finger movement, and the wrist movement while scaling. Some of these things we fall into habits to over periods of time, and it's always good to just go back and assess when you have a minute if finger movement is happening, if your movement is initiated from the arm, if your wrist is in a neutral position. All of those things should be happening. Electronic instruments. There are several types of electronic scaling instruments, and whether you enjoy using a Cavitron or a piezo scaler, they should be situated in the operatory in a place that doesn't require twisting to get to. It should give you plenty of loose cord to prevent hand strain, and it should be held with a slightly loose but controlled grip. Many practitioners loop the cord loosely once around the wrist or the pinky finger to ensure the cord does not have pullback that can cause hand and wrist fatigue. And then we have the relief saliva ejector. I've never used this, but I wanted to show you this as an example of ways that manufacturers are coming up with creative ideas to help make our jobs easier, that more effective and then more comfortable for our patients as well. If you've ever tried it, I'd love to hear from you what you think of it. And I just thought it was interesting for people to see. So we have much better small equipment choices than we did even 10 to 15 years ago. I'm going to show you my age here, but when I say when I began to practice, electronic instrumentation was not commonplace. Nitrile gloves were unheard of, and the thought of a keyboard in every operatory never occurred to me nor anyone I worked with. So things have changed, and they continue to evolve. I wanted to show you some newer small equipment that's on the market and has some great features that might be beneficial for you. The iProfi Air. This is a corded handpiece specific to hygienists. It's lighter in weight than most of its competitors. It has a shorter length and 360-degree swivel for easy maneuverability. It's quiet, it runs smoothly, and it works with all disposable prophy angles. On the right-hand side, we have the iProphy Mobile, and this is a cordless prophy handpiece that was introduced in 2019. It's lightweight, well-balanced for less wrist strain, and it works with all disposable prophy angles. It has 5 speeds and a hand control, so no rheostat is needed. It's quiet, easy to use, has a small head, and is ideal for adults and children alike. Next, we have the Varios iPiezo series in the lower left corner. And this is a piezo scaler that has the slimmest and lightest handpiece available on the market. It allows easy accessibility to posterior areas, and it also has an optional LED light built into the handpiece. This version has reservoirs for alternate solutions and a wide variety of tips for general scaling and periodontal applications. The iPiezo also comes in a version that can be mounted to the operatory delivery system for easy access and optimal accessibility. These are all products that have only been available in the US market for the last 7 years or less and are made by NSK. These products are great examples of how engineers are becoming more aware of details in the designs of equipment that take into consideration not only effectiveness and reliability, but also the practitioner's ergonomic needs, including weight, size, balance, improvement of the visual field, and noise. PPE. This has come more to the forefront for sure over the last year. It's always been important, but it's really, with COVID, has become even more important. So it is beneficial for you to make sure that your PPE doesn't restrict your movement. Ideally, it's disposable. It provides the protection necessary for you and your patient. And face shields in particularly have become more popular over the last year from what I've seen. So in addition to the use of sometimes N95 masks in certain situations, especially early on in the COVID situation, but wearing loops and face shields together can be challenging. So if you were wearing loops and suddenly you added a face shield, you may have had a problem there. However, some newer designs have taken this into consideration. So I encourage you to find out what works best for you. There are some face shields that are made to sit far from the face so the loops can fit underneath. And this might be good to consider so that you can continue to wear your loops and provide your best ergonomics for you while you care for your patients. What hygienists and most dental professionals do is repetitive. We begin our time as a hygienist to be very self-aware of our body positioning because it's all so new. As we repeat the behavior, as with any behavior that's repeated, we form habits. Once these habits are formed, they're hard to change. We hope to have formed good habits through our education and through our training and carry those into our practices. In school, you likely had some ergonomic training. I think about 95% of schools provide some type of ergonomic training during your educational experience. And you've also probably had some reinforcement throughout your clinical experiences. You know, the clinical teacher that's always sitting over your shoulder, asking you to straighten up, telling you to put both feet on the floor, don't twist so far, make sure your patient is positioned correctly. You know all of that. But after we begin practicing, a few things happen. First of all, you've got all different equipment arranged around you in a different manner than it was in school. You're now seeing a lot more patients daily than you did during your education. And many of you have been doing this for years and years. So we all know that time management and efficiency becomes much more important, unfortunately, sometimes at the expense of our bodies. You do not have anyone over your shoulder correcting your positioning when those bad habits start to creep in and when we're in a hurry. This is where self-awareness and self-assessment of body positioning and movement is critical. We'll review some basic ergonomic principles that you learned in school so you can go back to the office with a fresh set of eyes and self-assess, or maybe have a coworker assess you or video you so that you can watch yourself, because we all, at least from my personal experience, what I always think is happening is not necessarily always what my body is doing. So on another but somewhat related note, proprioception or self-awareness of the position and the movement of the body decreases as we get older or in the face of injury. The good news is that there are exercises when done regularly that can help restore this proprioception. Many of these exercises include balance improvement, and it has something to do with the feedback mechanism sent to the brain and triggered by the sensory nervous system when muscles are called to act. When this process is repeated over and over, as it is with challenging balancing positions, especially if they're held for a longer period of time, the brain fine-tunes the response and there's improvement in your proprioception. Next, we're going to talk a little bit about classifications of movement. All right. And then we're going to move on to operator positioning, patient positioning, economy or efficiency of motion. And this is going to give you a basis for self-assessment when you go back to the office, and you can begin to look around and decide if there are changes in your approach to your patient care that are necessary. That might be small changes that could help keep you healthier long term. First, the classifications of movement. I was a hygienist for 17 years before I learned about these classifications, but once I learned, I could further assess my risk for injury more effectively. I hope you can do the same. So we have class 1 movements, and this is movement of the fingers only. This is oftentimes done, an example would be during an intra and extraoral examination or possibly a cancer screening. Class 2, we're talking about finger and wrist movement here, possibly picking up and placing an instrument in your hand and scaling. Class 3, fingers, wrist, and elbows. So reaching for a handpiece or saliva ejector are many other things that we reach for. In an ideal world, these should all be less than about 21 inches away. We know this isn't always possible, but look where your items are located. Kind of go in and assess to see if there may be a convenient way to bring them a little closer to you so that your reach lessens. Class 4 movement is movement of the entire arm and shoulder. An example of this would be changing your overhead light position. We should try to limit this movement, but the reality is that this has to be done usually a couple of times during patient care. Also, if you have a newer light, a newer equipment setup, typically the light is much lighter in weight and it's a lot easier to move. If you have an older operatory, sometimes the lights can be very heavy. They may stick and may not be easily movable. So this may be something to consider changing out or having serviced if needed. Then we have class 5 movement. This is turning the entire torso. This would be turning to pick up an instrument or enter notes onto a computer or reaching for something while twisting. It's best if we can try to limit class 3, 4, and 5 movements while providing your patient care. For example, if you're probing and charting and the keyboard is behind you, there's going to be a lot of class 5 motion to record all the pocket depths. This is not ideal, and repetitively doing this every day could begin to cause strain on the body that could lead to injury. So less motion, including the number and length of movements, may decrease the risk of injury in the workplace. The efficiency of motion. So this is something that we kind of do subconsciously, and I just want to bring it to your attention so maybe you can assess this and how you're working with this in your operatory or in your office. But in order to improve it, it's best to stay organized. Cassettes can help with this. I think we were all taught to maximize the use of one instrument typically before switching to another instrument, but I know that sometimes when we get into private practice, this doesn't always remain that way. Try to place the instruments in order according to how they're used, and then have the trays set up in advance in the same sequence for every tray for each procedure. We want to place this armamentarium as close to the patient as possible, not over their face, certainly not over their face, but down to the lower right side of the patient, an easy, accessible reach and reach for you. So these are just a few things that can be done to increase your efficiency or your economy of motion. It's important to note that every operatory is different. Every office is different. but I encourage you to look at your office and your operatory with fresh eyes and see how you may be able to optimize your economy of motion while you work. There's no perfect fix, but changing even the small things can lead to a better overall outcome for your comfort during your career. Let's talk a little bit about patient and operator positioning. So try to picture yourself in your most recent clinical procedure that you performed. Are you leaning over the patient or is your back erect and straight? Are you craning your head to get a better view or is your neck relatively neutral? Are your hands grasping your instruments tightly or are they relaxed and letting the sharp blade of the instrument do the work? Are your wrists bent or neutral and relaxed? Are your elbows close to the side, angling downward, or are they lifted higher than 90 degrees, as this picture illustrates on the left? Remember, keeping your arms closer to the body is always advantageous, and keeping neutral positions in the neck, spine, and wrists are important too. Now that we've seen some incorrect positioning, let's review some aspects of correct positioning. We're going to discuss correct operator positioning here for a moment. This practitioner, she's seated at a 12 o'clock position. She's pronated gently forward at about a 10-degree angle with her knees slightly lower than the hips. This allows the pelvis to remain in a neutral position. Her back is straight and her head is in line with the neck while utilizing the loops to see the necessary visual field. Her elbows are tucked in close and the patient's nose is just about at elbow level with the patient close to the end of the chair, close to the top of the headrest. She's sitting close to her patient and her feet are flat on the floor. If you can, always try to face the patient directly during the treatment and have them turn their head as necessary to allow the best access to the oral cavity. You can use indirect vision when necessary and keep the visual field well lit. If possible, try to evenly distribute your weight in a tripod pattern through having both feet on the floor and a solid connection with the chair. If you don't already use loops, again, I know I keep saying that, but I really believe in loops. They do require a learning curve, but long-term, I do think it's worth it. On the lower left picture, we show an operator chair where the upper portion of the chair conforms to the back and it offers support while leaning slightly forward. There are some newer chairs that do this, and some people like this and some people don't, but it is an option out there for you. I do recommend having a chair with a back as opposed to no back, certainly, if at all possible. It just offers support when necessary. While we're talking about positioning of the operator, this is a really quick cheat sheet that's going to go way back to the beginning of your dental hygiene training. After working in private practice for about 17 years and then beginning to teach, I realized I had created some of my own seating positions that weren't exactly lined up with the clock positions. This was partly due to bad habits that had creeped in over the years, but also partly due to lack of accessibility in some of the offices that I worked in. The operatory wasn't big enough or there was equipment in the way. I couldn't move around the chair. So I encourage you to go back and look at your operatory and make sure that you have the accessibility necessary. I certainly hope these habits haven't creeped in for you, but it's a good idea to revisit this every once in a while to ensure that you're operating with the most efficiency and the best ergonomic way possible. Please feel free to take a screenshot of any of the slides or any of these pictures for your reference so you can take it back to the office and see if you've maintained proper clock positioning through your years of practice. With newer operatory designs that have more clearance in general, I've seen more hygienists successfully accessing the posterior away areas from the 1 o'clock position with the patient's head tilted up and slightly toward or away from you, depending on the quadrant you're accessing. This may be something to try if you have the room to do so. And if not, the 10 to 11 o'clock position is fine too. Now we're going to talk a little bit about patient positioning. We've got our little mannequin patient with a mask on over there. But ideally, patients will be in the supine position for most of the clinical procedures. It's recommended that we place the patient chair back at about a 10 to 15 degree angle from the floor. So in other words, it should be supine with just a slight elevation of 10 to 15 degrees of the back of the chair. If the patient has a hard time maintaining this position, sometimes a cervical support cushion can improve the patient's comfort while reclining either under the neck or under the lower back. Also, don't forget that when treating the upper arch, the occlusal plane should be tilted upward about 15 to 20 degrees from the vertical plane. And while treating the lower arch, the occlusal plane should be tilted down about 30 degrees from the horizontal plane of the floor. Basically, that just means have your patient tip their chin up when you're working in the maxillary arch, adjust the light accordingly, and then have them tip their chin down when working on the lower arch. Another thing that we don't think about that often, but does make a difference, are our instruments. Are they sharp? We've got a picture of a man sharpening a knife here, but our instruments aren't quite that big. And this is typically not something that most hygienists enjoy doing. However, I don't think that we can use that excuse anymore because there are so many automatic sharpening tools that make it much easier. And honestly, if it's done regularly with just a few strokes, an instrument will regain the sharp, effective edge. Even with the newer instruments that aren't meant to be sharpened as regularly because they maintain their edge longer, hygiene instruments aren't meant to last forever. They should be replaced on a regular schedule depending on the wear and tear and the patient load. Newer instruments do tend to stay sharp longer, and there are places you can send instruments to be sharpened if you don't want to sharpen them. But keeping them in the best working condition lessens wrist and finger strains, as well as decreasing the risk for injury to the practitioner and to the patient. So earlier you saw a picture of a really old delivery system and another operatory setup that wasn't ideal. This picture, we're going to go through a little bit more of a modern open operatory designed with ergonomic processes and optimization in mind. These are all just things to think about as you go back to your operatory. So these chairs have slimmer backs, which allow the practitioner to move closer to the patient without having to twist or turn. The delivery system is able to be brought close to the patient with easy accessibility to small equipment and instruments. Hoses for evacuation can be moved to either side of the chair to make this a left or right-handed operatory. And these hoses can remain close to the patient for easy accessibility. Remember, we talked about having them closer than 21 inches away. The headrest moves up, down, and it can tilt upward or downward to help you position the patient's head in the best access for the areas that you need to get to. There's full clearance around the chair for the operator to work easily in the 8 o'clock position all the way around to the 1 o'clock position. So these are some of the things that make this a more optimally ergonomically designed operatory. If you have the luxury of working in an operatory with equipment and clearance such as this, that's wonderful, and I hope that you are enjoying every minute of it. But even with this modern setup, I still don't see a tray for a keyboard or the ability to access one easily. And the truth is, we don't all have the luxury of choosing or buying our own equipment, and most of the time we work with what we've got and we do the best that we can. It's typically sufficient to do our job, maybe not in the Cadillac fashion as pictured here, but maybe more like a Chevy or a Ford. And this is okay because no operatory is perfect. But what I hope that what you've seen so far will spur you to rethink how you utilize what you do have and to try to make the best of your equipment and to optimize the environment that you're in on a daily basis. Having said that, even if you do work in the best of offices, MSDs continue to be prevalent in our profession, and we need to be aware of this and do what we can to prevent them and to catch them and treat them early on so they don't contribute to an unhealthy quality of life, professionally or personally. So we know that MSDs are prevalent for hygienists and dental professionals in general. And there are some things that you could do at work to help ensure that you have the best chance possible of staying physically well. We just reviewed some of these things and how to assess those. But what are some things that we can do outside of the office that may impact how we feel inside the office? We've got a few things pictured here. And these are all pretty common sense things that we do know, But I just want to bring it to the front of your thoughts for a moment, just to encourage you to think about um, these various things. Assess what you're doing and see if there may be room for improvement. We know that maintaining a healthy lifestyle through good nutrition, exercise, time with loved ones, sometimes time alone, and sometimes when life gets really crazy, we just need to take a minute and breathe. And if we are in a healthy place physically, emotionally, socially, and professionally, I believe this translates into a more productive, more content workplace and life. Change happens one small repeated behavior at a time. If there's something on this list that you see over here in any one of these pictures, whether it's a nutrition, whether it's exercise, time with your loved ones, or time just alone, if there's one of these things that you feel like you really could improve on, I encourage you to choose one. I would say just one, and make small, consistent changes over time. You'll begin to feel the benefits, and slowly, one of these things will become a way of life. So, what happens when you've done everything you can do? We've assessed our habits, we've adjusted our ergonomic interactions, we've changed habits if it's needed. Maybe we've even invested in some equipment to make our job a little easier. It's possible that we've even made lifestyle changes, or maybe you're just one of those people that has always lived a really healthy lifestyle. But overall, you're doing pretty well. And then suddenly life throws you a curveball. Pain begins to set in, which may be a slow onset or possibly immediate onset. Personally, I remember working on a patient. We were talking, and I twisted to pick up an instrument, and I suddenly couldn't breathe or move because my back had spasmed in an excruciating way. Eventually, I was able to slowly twist back and face forward and ended up dismissing the patient, who was very kind and understanding. And then I called my doctor. At that time, I didn't realize that I had a musculoskeletal disorder or that there were options in how to take care of myself for this condition. Today, I want to give you some options to help you help yourself or others if you are ever in need of treatment. And this is by no means every option, and it is definitely not medical advice, but it's information that you may be able to research a little further and find out if some of these things may be useful for you or someone that you know. The first approach we'll discuss is the allopathic or traditional Western medicine. Traditional treatments for musculoskeletal disorders include drug therapy, NSAIDs for acute pain management, steroid injections or systemic delivery of steroids. And there are some newer approaches which include local delivery of medications through like nano capsules that are delivered through carrier hydrogels. That was kind of an interesting thing to research. Some of these haven't been terribly successful, and the research continues with them. But once a lot of these options have been utilized, if improvement isn't made or the situation worsens, surgery is considered as the next option. Physical therapy is incorporated among these as well, whether it's an adjunctive treatment to drug therapy or surgery. Many times it's incorporated into this treatment. And we're going to talk a little bit about carpal tunnel specific because this is the highest reported MSD in dental hygienist. And many times the onset is within the first 10 years of practice. So traditional methods of treatment include activity avoidance. So if you can quit your job, then that's great, but most people can't do that. Steroid injections or oral steroids, NSAIDs, splints, or ultrasound to help relieve inflammation. Sometimes vitamin B6 supplements can be used as an adjunctive therapy. But in 2011, there was a study published that indicated acupuncture could be useful in the long-term relief of CTS symptoms. However, the study hasn't been repeated, and the quality of the study came into question through a Cochrane review. All that to say, it's controversial as to whether acupuncture is helpful in the long-term treatment of CTS. But I will say from reading all of the journals that I investigated, the one thing that I did learn is that acupuncture was not reported in any of them to have any adverse side effects. However, other treatments commonly did have adverse side effects. So it's just something to put out there and maybe worth considering as an alternative or adjunctive therapy for pain relief if you have carpal tunnel. That leads us right into complementary alternative medicine. Acupuncture would be considered a complementary alternative medicine or a CAM. We'll talk about these as CAMs. Some of the other CAMs, one of them that's very popular is chiropractic care. I think we've all heard of a chiropractor. Many of us have seen a chiropractor. Massage is very typical. Some breathing exercises. This has recently come to light that breath can affect our autonomic nervous system. And homeopathy, this is based on the belief that the body can heal itself through the introduction of tiny amounts of natural substances that then stimulate the healing process. Meditation, we'll talk a little bit more about that. Reiki, which is energetic healing, and this is based on the principle that the therapist can channel energy into the patient by means of touch. And this activates natural healing processes of the patient's body, and it helps restore physical and emotional well-being. Reiki is an Eastern type of treatment and is gaining popularity here in the West. I couldn't find a lot of research about it, but what I did find actually showed some positive insight or possibly positive effects of Reiki. We're going to talk more about yoga and then herbal supplements. So there's not a lot of research to support herbal supplements per se, but if you do get them and you do believe them, believe in them, make sure that these are from a reputable source and that you know the ingredients, because typically herbal supplements are not FDA regulated and they may contain fillers or other substances. So you just want to make sure that you're getting quality material. Looking a little bit more at chiropractic. Basically, chiropractic is a system of medicine that is based on the diagnosis and manipulative treatment of misalignment of the joints, especially those in the spinal column. And I think I'm not going to assume, but I would imagine that most people know that if you've seen a chiropractor when they crack and pop your spine. But interestingly, and the reason I mention this is because there was a study by Osborne that indicated that hygienists sought various methods of treatment, including exercise, heat, medication, massage, ergonomic changes, bed rest, chiropractic treatment, weight loss, and or the use of a back brace. What hygienists reported to be the most successful was chiropractic treatment of all of these options available. Massage. So the earliest written records of massage were discovered in Egypt and China between 2500 and 3000 BC. It's also reported that Hippocrates prescribed massage or friction therapy to help heal his patients. Massage has been shown to break the cycle of pain, elevate serotonin levels, and possibly realign muscle fibers and increase muscle circulation. It's considered to be an adjunctive therapy to other therapies. Talk a little bit more about acupuncture here. It's been used for thousands of years in traditional Chinese medicine, but its population is growing in the West. There are several theories on how acupuncture works. One is through immune system modulation. Another theory suggests it stimulates the secretion of endorphins, serotonin, and acetylcholine in our body. And these are all theories, and ultimately no one really knows the exact method of how acupuncture works, especially related to analgesic effects. We do know it has been around for thousands of years, and many people report relief. However, the science is still a little unclear behind this. But if you choose this route for treatment, make sure you are visiting a reputable, well-trained acupuncturist that is using sterile methods. Meditation is considered a type of complementary alternative medicine. It has been shown to help enhance mindfulness and mental well-being, decrease perceived stress. It can also produce relaxation, peace of mind, lower blood pressure, lessen anxiety, and lower blood cortisol levels. There are many kinds of meditation, including mindfulness, spiritual, focused, and movement meditation, to name a few. I'm not going to talk about how to get into a meditative state, but what I would suggest, there are a couple of apps out there that are great. They're great introductions to meditation. One is called Calm, C-A-L-M, and there's another one called Headspace. So you may want to check out these apps. They do have free versions and they do have paid versions. I have the free versions of both, and they're kind of fun to mess around with. So yoga. We're going to go a little bit more in depth into yoga. This is just one approach in that multifactorial approach to help keep your body healthy. But yoga is the ancient science of body-mind coordination. Therapeutic yoga is the application of yoga postures and practice to the treatment of various health conditions, including occupational hazards. So a review on the use of Iyengar or therapeutic yoga for the treatment of back and neck pain over time showed that therapeutic yoga can decrease pain and increase functional ability in the spine. Other research has shown that yoga is more effective in relieving chronic neck pain than when compared with a home-based exercise program. And after 9 weeks of 75 minutes of yoga per week with an instructor, and then continued home practice after training for a year, patients reported less neck pain. Additionally, yoga participants have reported more body awareness during their practice and their daily lives, and maybe even more importantly, cognitively, participants reported increased perceived control over their health, and socially, many reported a renewed excitement for participation in an active lifestyle. So let's talk about some basic yoga asana principles. First, an asana is a yoga pose or a position, and yoga is accomplished through a combination of asanas and breath. Typically, the inhalation is done while moving into a pose, arching the spine or creating upward movements, and exhalation is done as you move out of the pose. The joints in our bodies can begin to move out of their ideal positions due to soft tissue tension, weakness, or imbalances. Remember, we talked about using compensatory muscles and sitting in awkward positions, and that's what we do all day? So over time, this can cause discomfort or pain. Yoga postures can be used to stretch and strengthen soft tissues, thereby affecting the position of the bones and letting them naturally come back to their proper position. Doing this repeatedly over a period of time helps reset the body and bring it into balance. This isn't something that's a one-time fix and you'll find benefit. It's likely if you only do it one time, you're going to be pretty sore after the first time you try yoga. It's through repeat practice that our body finds alignment, rest, and balance. And we're going to move on here pretty quickly. I have a few yoga poses to go through with you. Most of these I designed for you to be able to do in the office. This is not a yoga flow class. And basically I chose these poses, first of all, because you could do them in the office, but they all lead to better spinal alignment and strength, which is beneficial for anybody in our profession. I also tried to keep them simple so that they can be done at work, between patients, or sometimes when you have a short break during the day. Others, the last couple of poses would likely be performed at home. So this isn't a sequence again, but just an introduction to some yoga poses that may lead you to want to learn more. So the first pose we have here is called the cactus arms pose. And in Sanskrit, it's called Sukhasana. And again, if you want to take a picture of any of these slides, we're going to have to go through these fairly quickly here. But please feel free to take a picture of the slides. Each of them has instructions on how to get into the pose and also some modifications and some things you need to watch out for if it does cause pain. But to get into this particular pose, you're going to inhale through the nose. And while you're completing your yoga poses, you want to try to always inhale and exhale through the nose. Lift your arms overhead while bringing your shoulders down your back and away from your ears, and bring your elbows parallel to the shoulders and squeeze your shoulder blades together. You're going to then inhale and exhale for about 4 to 5 breaths. You can repeat this several times throughout the day. If you're not sure if your shoulders are rolled down your back, begin by lifting your arms and trying to touch your ears with your shoulders, and then exhale and pull your shoulders down and slightly back. So I'm not going to read through all of the benefits. You can see those on the slide. We're going to move on to the next one so that we have time for a couple of questions at the end. Next is a crescent moon pose. On this one, you're going to inhale and raise your arms overhead. Bring your palms together and you line up the biceps with the ears. So pay attention to where the arms are. You're exhaling as you bend to the right or left side. And what's important to remember is that you're bending from the spine and the hips should stay in alignment with weight in both legs. And as you bend, you're going to hold that bending for 5 breaths and repeat on the other side. You can cross one foot over the other. This helps to improve balance and it begins to get into the IT band for certain individuals. It's a great pose to do between patients if you have a moment at the end or at the end of the day. This also helps keep the spine pliable and refreshed. Wrist stretches, this can definitely be done at work and it provides a little relief, especially after a difficult patient. So with this, you're going to stretch the wrist 3 ways. You inhale, extend the arm with the palm up, and exhale as you begin to point the fingers toward the floor and reach with your other hand to pull your palm toward you. After holding this for 4 to 5 breaths, release and then flip your palm down. Point the fingers toward the floor and reach with your other hand to put slight pressure on the fingernail side of your hand. Again, hold this for several breaths, release, and then point your fingers to the sky. Reach forward one more time with your other hand and pull your palm towards you. You can easily see in the pictures up here that it's just bending it 3 different ways. And then you're going to repeat this with your other hand. And these just take a couple of minutes at work, so they are not terribly involved. So the next couple of poses, these would likely be done at home or in a gym setting because typically you're going to get down on the floor to do these. But if you're really comfortable in your office and you know that it's clean and you don't mind getting down on the floor, you can certainly do them there too. So this is called the cat-cow pose. You're going to begin on the hands and the knees and inhale as you arch your back, lifting the chin and the bottom toward the sky. Exhale, tuck the chin toward the chest, round the spine, and tuck the bottom toward the ribs. So you're going to repeat this several times, moving in sync with the breath and breathing through the nose. And I will let you read through the benefits of that. There are some modifications. You can wrap a towel up, roll a towel up and put it under the knees if you have sensitive knees or if that causes pain for you. And then we have the lunge twist. This is probably the most advanced pose that I put on here. And this is a great pose to help bring some circulation into the back and the upper body. But on this one, we're going to raise the arms overhead and inhale, and then exhale as you bring the elbows parallel with the shoulders. You step forward into a pretty wide stance, inhale again, and as you exhale, bring the palms together and twist. You can see my model Lacey here is able to easily bring that elbow to the outside of the knee. And if you can't do that, that's fine. Just begin to twist in one direction toward the knee. So another modification for this is to bring that back knee to the ground. And again, use a towel under the knee if needed for cushioning. Our last pose is the seated half twist. You're going to sit with both legs extended straight in front of you. And by the way, just sitting on the ground with both legs extended straight in front of you and with an erect spine will also help build lower spinal muscles and core muscles. So after you sit with both legs extended, to get into the seated half twist, you bring the left ankle over the right knee and place your foot flat on the floor. Inhale and bend the right knee toward your bottom. Exhale and twist, placing the right elbow outside of the right knee and keeping both hips as close to the ground as possible. Hold for 5 breaths and then repeat on the opposite side. So this asana or this pose will help keep your spine limber and increase the blood supply to the spinal area. So that is the last recommended exercise. All of these poses, when done consistently over time, help build strength and flexibility, and some also help with balance. These are introductory poses, and if you'd like to learn more about yoga, I would recommend that you look for a local reputable studio in your area and take a few classes. There are also power yoga classes, which are aimed at building strength through body weight, exercises, balance, and flexibility. And these are a great option if you already exercise, you're already in pretty decent shape. I thought I was in decent shape until I went to my first power yoga class. They can be pretty challenging. Also, right now in our current situation, online classes are a viable option if, I would say if you're a more experienced yogi. In my opinion, I think the benefit of a face-to-face class is the personalized instruction and assist that you receive, especially if you're a beginner. So we've shown that staying pain-free in the dental profession is challenging for many, if not most. Recognizing this and realizing that there are things in our environment and lifestyle that we can change is helpful. Some takeaways that I hope you have from tonight are that MSDs continue to be a concern in our profession. even with modern equipment and technology advances. You can begin to help yourself by assessing your environment and interactions with your patients and equipment to ensure that they are optimal for your situation. Begin to recognize clinical habits that may harm your health long term and start to make changes where necessary. The treatment of musculoskeletal disorders requires a multifactorial approach, and the incorporation of complementary methods of treatment alone or in conjunction with traditional medicine can be successful for many. Incorporating self-care and healthy habits into your routine and lifestyle is important, and yoga may be a useful tool to help build strength, flexibility, and well-being when done regularly. Research needs to continue on ergonomics, human factors, and the use of complementary alternative medicine as viable and effective in the treatment of MSDs in our profession, specific to each type of dental care provider. And finally, development of long-term programs to combat MSDs and that encourage proper ergonomics, traditional and complementary methods of care, and ongoing healthy lifestyle choices that continue beyond the educational setting will be beneficial for our profession. Thank you all for joining me this evening, and please feel free to reach out to me at sstedke@gmail.com. I put my email address down there on the bottom of the slide. Should you have any questions or if you'd like more information about anything on the presentation this evening. So at this point, I think we can open it up to questions. Okay. Examples from Missy, examples of motorized or electric sharpeners. There is one called the Hugh Freedy Sidekick that is it's a little handheld device, and there are pretty specific instructions with it. I have used it before and liked it fairly well. Thank you. Okay, but we'll be starting again soon. Well, I'm glad to see that some of you may start doing yoga again. That's encouraging if you have been doing it, maybe gotten away from it. Some things to reduce pain and tension in the hand and wrists during patient treatment. I would say, get hand pains sometimes, especially when working on the very back teeth. I would possibly go back and check the grip on your instruments. Make sure that you're using larger handled instruments and possibly electronic instrumentation in the back. It will work for you and be your friend in that situation. And I hope that, you know what? Someone's asking about recommending a good operator chair. I can investigate that for you, Allison, and let you know. I do like the ADEC brand. I think it's worth checking out. They do have some good operator chairs on their website. So there's a couple different versions. Okay. How often should you do massages, chiro, etc.? That's not something that I can answer. I think that would be up to the discretion of your massage therapist and your chiropractor. I have had both treatments over periods of time, and they've been very good at directing me at what they think would be beneficial for my body. So I would say the same if you are visiting a massage therapist or a chiropractor. They will give you recommendations about how often to come back. So Toby asks if there's any recommendations for hand or thumb muscle pain. I would say massage of the area for recommendations for hand and thumb muscle pain. Also maybe some ice packs incorporated with alternating ice and heat. And possibly even massage therapy. And I would also, honestly, I would check out acupuncture to see if that may relieve some of the hand and muscle strain. Okay, everyone, thank you all so much for joining me tonight, and I appreciate all of your time.
Thanks for attending this Viva Learning webinar. In order to get your CE credit, you will need to pass the CE exam. To do so, return to the website, make sure you are logged in, click on either CE in Progress or My Account. Click on the webinar title and take the CE exam. Thank you, and see you next time on Viva Learning.